Welcome to Lighthouse Surgical Suites. I'm Joseph Cavalis, one of the surgeons who practices at this facility. Today we're going to talk a little bit about the patient experience and going through the process of what a surgical day might look like from the patient's perspective. You'll arrive at the center 2 to 3 hours prior to your surgical scheduled time. Of course, you're coming in with your companion, loved one, family member, or friend. You'll be greeted by name because we're expecting you and you're one of a handful of patients we're seeing that day. You'll be asked to fill out some paperwork, and at that point, you're subsequently escorted back to the surgical area for prep. At this point, we will ask that your family member remain outside. They're welcome to wait in our waiting room. The nice thing about our location here in Hollis is that we have a number of nice restaurants and boutiques and shops around. As soon as you're escorted back from the waiting room, you're going to meet your pre-op nurse. They'll check you in. What this means is they're going to begin by showing you to a room. They review your medications, they review your past medical history. You'll then meet the surgical team, which of course includes your surgeon and the anesthesiologist. Go over any last-minute questions the patient may have. Part of the advantage of being in an outpatient ambulatory center, of course, is that the plan is to get you home that day. What that means by and large is that you'll rarely have a breathing tube or go under general anesthesia. This means less grogginess, faster recovery. The literature says that you're less likely to have pain post-operatively. The other big advantage of being at a center like this that's recently built is that we have the latest technologies and advances in orthopedic surgery. Here at Lighthouse, we're very lucky to have one of the first robots in the region. This allows us to do the most cutting-edge procedures for our patients and really gives us outcomes that we think allow us to get our patients home with better outcomes and a faster recovery and less pain. You can estimate that after surgery, you'll spend anywhere from 3 to 5 hours with us, ensuring that you're safe and ready to go home. About an hour after coming out of the operating theater, the therapist or one of the nurses will come by and start to work on mobilization with the patient. This will start with something as simple as getting your clothes on and getting you into a chair, and then it'll rapidly progress to standing, walking to the bathroom, and then eventually doing stairs. Around this time, we also typically ask the companion to come back. Then their role is to really help you remember and understand the imparting information that we're giving to you, because it can be a lot at that time. Once you've achieved all milestones, we start going through the discharge process. What this entails is planning for your return home. We'll also go over a number of discharge instructions. The nurses are great about this, and they're specific to every procedure and every surgeon that you have. You're given a packet, you're given a number of resources to refer to. So by and large, and again, it depends a little bit on what procedure you're having, I would say that the entire spectrum of the time that you spend at the center for your surgery is probably less than 8 hours. From check-in to surgery to post-op recovery, you can likely expect about an 8-hour episode. Probably the most important part to a successful recovery is a well-engaged patient. And there's a number of resources from our offices as well as on the internet for patients to engage and learn about the expectations. We hope you found this video and information helpful. We look forward to helping you meet your goals and have the best outcome possible after surgery, and rest assured you'll be in the best hands possible with the team here at Lighthouse Surgical Suites.